So now that we talk about the way that we diagnose narcolepsy, and we talked about normal sleep and REM, now we can actually understand the symptoms a little bit better. And indeed, you can have sleepiness that's coming into our daytime. Another thing that's important to know is that there's narcolepsy with cataplexy, and then there's narcolepsy without cataplexy. So not everybody has all of the symptoms. Some of the other symptoms that are now going to make a little bit better sense to us. Again, the sleepiness, but we can also have cataplexy. Again, remember, in REM, our muscle tone is low, almost like a paralysis, and cataplexy is the intrusion of that low muscle tone that comes into our daytime. And it can be as profound as passing out, or it can be as subtle as muscle tone that may come down, your jaw may come down, difficulty verbalizing, difficulty speaking during a stressful period. Again, we have these hypnagogic or hypnopompic hallucinations, and that is not psychosis. It's really actually not really so much a hallucination, but what it is, it's a dream while you're awake. You can see literal, vivid images. One thing that's important is to realize how much of our dreams actually always make sense. And sometimes these hallucinations don't make sense as well. I've had patients tell me that they've seen a number of different things, from blood, mirrors, demons, lava rocks, people who they know, people who they don't feel that they've ever seen before. I had one person tell me that they saw midgets laughing at them. Another kid told me that he was riding his bike, and then all of a sudden he saw a house and he fell off his bike. And then when he looked, the house wasn't there anymore. And what that is that dreamlike image that's coming into our daytime. Sleep attacks, you may have an uncontrollable urge to just go to sleep. The sleep paralysis, again, you're awake, you know you're awake, but your body can't move, almost like you're paralyzed. And that's that low muscle tone, that REM atonia that leaks into our daytime. And it happens mostly as you're waking up or as you're going to sleep. And then you can also have nocturnal disruption of sleep. So what happens is, just like you have this intrusion of REM that's coming into your daytime, you can also have intrusion of wake that comes into your night. And more than half of patients with narcolepsy actually do complain of insomnia. And a lot of the patients that I have that have a diagnosis of narcolepsy, many of them actually came to me first complaining of insomnia. Why would they complain of insomnia? Well, number one, because they're tired. People who aren't tired don't complain that they didn't sleep well. Some people laugh about it. I was up all night. But the person who has a disorder of sleepiness, they're going to complain about it more. But number two, you do have these intrusions of wake, and they do commonly have more fragmented sleep during the evening. Now, in evaluating demographics and taking a look at the different age ranges, the most common age range that we see these symptoms of narcolepsy start to come out is actually 15 to 19 years of age. And the second most highest is actually from 10 to 14 years of age. Now, what unfortunately actually is more common is that these symptoms will come out and over a decade will go by without a proper diagnosis of narcolepsy. They may be told that they're depressed, and unfortunately they may be placed on a sedating antidepressant, and then they wonder how come that didn't help. They may have early on been diagnosed as ADHD, or that they don't have attention, and it's even more unfortunate when they're called lazy because they're sleeping, or okay, you're having another sleepy moment, how come you can't just stay awake? It could be very hard for an adolescent going through these symptoms. Now, one of the terms that I really don't like is pediatric narcolepsy. And the reason why I say that is that you don't have to say wet water. You know that water is wet. Well, the same thing. Narcolepsy starts out in the pediatric age range. So narcolepsy is pediatric, and it's very important for pediatricians and parents to know these symptoms as well. Signs of pediatric narcolepsy that have been described include the daytime sleepiness of narcolepsy may present as sleeping at school or the reappearance of regular daytime naps. Narcolepsy in children can also manifest as behavioral problems, decreased performance, inattentiveness, lack of energy, or insomnia. Affected children may be misdiagnosed with attention deficit disorder, hyperactivity disorder, schizophrenia, or depression. Now, cataplexy, it is muscle weakness, and it's generally bilaterally. It's generally both sides of our body, and it is usually triggered by strong emotion. Sometimes you can only see partial, so it can affect just the voice or the face, or you may drop something. Consciousness is very generally preserved, and the frequency can vary. You can have a few episodes every couple years, or maybe even a few episodes a day. And the duration could be seconds, or it could be minutes as well. Laughter is indeed the #1 trigger, but it's not the only trigger. Any emotion can bring out the symptoms of cataplexy, whether it is anger or happiness, anything, sadness. And a lot of the patients that I've had with narcolepsy many times actually have been diagnosed with anxiety disorders. And anxiety is real, but patients with narcolepsy, I feel, literally can feel their emotions. They have an emotional period, whether it is laughter or anger or anything, and their body generally feels different. That's that cataplexy that could be coming in. One of the reasons that they could be diagnosed with anxiety is because the patient himself doesn't understand what's going on, and sometimes the physician itself doesn't understand narcolepsy as well.